No mai, hara mai everybody. Welcome to this webinar. We are really happy to have you here for us to share the journey of the reviewed and reimagined model of care. Ko te mea tuatahi, he tika ka karakia mātou. Māku e tīmata. Me mahi tahi mātou, ka kōrero, ka wānanga, kia atawhai, kia manaaki mō ngā whānau me ngā hāpori katoa. Kia koutou te tino rangatiratanga i o rātou hauora. Kia pai te taha tinana, te taha wairua, te taha whānau, me te taha hine ngaro hoki. Haumi e, hui e, taiki e. Kia ora everybody, my name is Marama and I'm here with Ni to present to you the Pou Ora brand new model of care. So Pou Ora means pillars of health, and this is the reviewed and reimagined healthcare home model of care. So we have kept the amazing elements of healthcare home and worked with our collaborative community to strengthen it for the future. The way that this webinar will run is I am going to go through initially the process of how we got to this point in time, describing some of the collaborations and consultations that we've been through to bring it to this point. We're then going to go through an overview of the model, and then each of the 5 Pou, we will have a more in-depth discussion about what they are, what they mean, and what can be implemented within your primary or community practice. If you have questions, please feel welcome to use the chat function, and me and also Jess Morgan French will be monitoring that, so feel welcome to put your questions in there. The other thing we invite you to do is Ni is going to send you a link to a PDF version of the document. Some of us like to see it on screen, and some of us like to have it within our own control so we can scroll through pages. So you'll see that come out in the chat. And the other thing that we invite you to do is fill out a feedback form as we go through this process. So the form is structured, the first part is just an overview, which we'll invite you to do after we share the 5 Pou with you. And then the form has a section for each specific Pou. So as we run through those, please fill in the form so that you don't have to go away and do that at another time. Are they in the chat me now? Beautiful. So yes, go in, have a tutu around, and so that you can share your feedback as we go. So we have had an incredible process for me personally, but also for the team, of developing a new model of care. In the beginning, we didn't know if it would be a new model or whether we would just enhance or increase the mahi of healthcare home, as we know it has been called, the model of care has been called in the past. So our advisory committee asked Collaborative Aotearoa to review and reimagine healthcare home. The very first thing that we did as the team of Collaborative Aotearoa is really look into our own experiences and those of our whānau when they are seeking care from primary and community care services. And we asked them to do a little video interview about their experiences, which we then used to anchor what we have here in stage 2, a 3 full-day wānanga session in Wellington at PwC, and they were hosted by Gareth Perry. And yeah, we spent 3 full days together really digging apart healthcare home. We looked at all of the amazing things that are in there and looked at some new ideas that we can add to it to ensure that it's fit for the future and also easily implementable within your practices. The next stage was then to kuhi all of that amazing learning and analysis, pull it all together and decide on what are we going to keep and what are some new things to add, which was a really robust process for us, which we are really excited about. We then pulled together a group of sector leaders who have worked with Healthcare Home before, and also lived experience advisors to explore what is needed in a future focused or future proofed model of care. We then ran 7, it was going to be 8, but we ran 7 online wānanga. They were 2 hours, they were really heavy and chunky, and we had some of them, I think we had between about 12 and 20 participants in those online workshops over those 7 weeks, where we dug into the words, each of the elements or characteristics, and then developed them further. We then pulled that all together and started to think about the concept. How are we going to pull this together? Are we going to keep it as Healthcare Home, or is it time for a new iteration of that? And that's where we came up with the idea of Pou, which I'll talk about a little bit on the next slide. So it started off with a wee sketch, then it became bigger on a whiteboard. We went up to Jess's beautiful whare up north, where we explored the possibility of having Pou as our guiding, as our guides, and we worked with Tui Taurua, who is one of our lived experience advisors on our board, and pulled it together into our first draft version. We then met with lived experience again to ensure that it would meet the needs of people who are using our services, and then kept tutuing, playing around, and then we sent it off to the printer to the designer to get to this place, which is our Pou Ora Pillars of Health model of care. So this model, it was really important for us to honour the incredible mahi of those who developed Healthcare Home and the Pou Ora enhanced model of care, which was Healthcare Home. But what we know is that now we're evolving. What we wanted for Pou Ora is for it to be easy to understand and implement, to be grounded in equity, and to ensure that in real life, on the floor, in our practices, that the elements of Pou Ora can be implemented really easily. So each of these Pou were developed, as I showed in the previous slide, a true consultation process where we gathered lots of your input and pulled it together. So we don't see this necessarily as the model that Collaborative Aotearoa wrote. We see ourselves as the people who brought all of your ideas together and then gave it back to you. So we really think that this is a by the sector for the sector model of care, which we're really excited about. So the 5 Pou are the next iteration of the Healthcare Home domains. We've included 2 new domains, which are workforce and collaboration. We also needed to ensure that we have a huge focus on innovative, up-to-date digital resources and tools that are available now that weren't available when Healthcare Home was being built. Things like AI, of course, has had a huge impact on the sector and enables us to do things more quickly. So, as we said, this model is designed to be clear, actionable, and well-resourced. And it's also flexible. So whether you're in a rural clinic or an urban collective, your ESU is small, your ESU is huge, we are hoping that this Pou Ora model of care will work for you. The 5 Pou we will work through one by one. What I'd like to invite you to do now is just to take a moment to think about the kōrero so far. Jump into your online form that is in the link and complete the first page of that. So there's just, I think, 5 questions. What's your initial whakaaro? What's your first response to this? And just a few questions there. So we really do invite you to jump in. I'll give you 2 minutes to give your overall whakaaro on these Pou. Oh, we can see we've got people in there already. That is amazing. Halfway. We also, just a side note, we have set up the form so that you don't actually have to fill in every question. So it's, if you have a specific thing to say, find the question that will give you an opportunity to share your whakaaro, but you don't have to fill out all the questions. But we do ask you to just give your name and organisation so that we can come back to you if need be. Kapai. So the first pou that we are going to look through is Te Pou Kaimahi, which is around our workforce. We know from data, statistics, and kōrero with our practices that we support is that workforce is going to be increasingly important with the changes that are going to happen with the people who are in the roles at the moment. So we know that the retirement age is going to have or people who are close to retirement age will have an impact on our practices giving care, and also that the people who are in our workforce feel supported and excited to be part of the primary care community. So what we want for our kaimahi, what this pou is leading us towards, is a sustainable and skilled workforce being the centre or the heart of quality care. So our people are the heart of our system, and this pou supports sustainable and culturally safe teams. Parts of the pou, some of the elements include advanced workforce pathways, cultural safety training, clinical consultation role, and will be supported by practical tools like a skill matrix, guides to run successful huddles, and succession plan templates. So this pou kaimahi for workforce is made up of 5 elements. So when we talk about workforce, we talk about the integrated multidisciplinary teams. We talk about clinicians having a consultation role, where teams engage in huddles and uphold cultural safety to deliver effective patient-centred care. I will invite you just to have a read through this either on your own document or the document that we're sharing on your screen. What we know, I'm not a kai whakairo, but what we know about pou is that they are formed or created from the bottom up. So our vision for how you use the elements is to go from the bottom up. So the most important, well, not most important, but the foundations at the bottom, moving up the rungs, I suppose. So ensuring cultural safety, that our kaimahi are all experiencing cultural safety as workforce in their place of work, and also all of the people, all New Zealanders and guests to Aotearoa who are receiving care at a primary care practice are given the aroha and the manaakitanga that we all deserve. So ensuring that cultural safety is important. The next element is around connected teams. So that is things like huddles, and we will provide different tools and resources and examples of exceptional practice. Having advanced workforce pathways, so knowing that you might start in your practice as something, but you will have pathways to increase your skills and also your opportunities for leadership within our sector. Clinician consultation role, and this was one of our wildcard ideas, I believe, from our initial three-day wānanga series in Wellington, where we talked about The traditional way of engaging with your general practice or your primary care team is to ring up or walk in, make an appointment with your doctor. They will resolve whatever it is you're in for, and then off you go. However, we know that the number of doctors that we have isn't meeting the needs of our communities, and so we have been exploring other new ways of using the expertise of our clinicians and doctors so that they can share their expertise with a range of kaimahi within their integrated multidisciplinary team. So that's quite an exciting new element to the model of care. And then once we have all of those beautiful things, we can ensure that our integrated multidisciplinary teams are, now I was going to use the word working top of scope, but I have actually seen that there is some whakaaro around that language, but ensuring that each person who is providing care knows exactly what they can do and how to do it, and has a plan for upskilling those skills throughout their career. The other thing we're really excited about in this new iteration of the healthcare home model of care is being really explicit about the value of implementing these elements into your service. So we wanted to make it really clear why you would implement these elements to support your whānau and the patients that you care for. So we've got 3 really clear points of, here are the things that we could do, and here is how it's going to actually make a difference to our whānau. We have then talked about the value proposition for the practice. So why would you want to implement this specific element? What is it going to do for you in your service provision? And also, what is the value proposition for our system? We know that we are all small parts of a big system, and so the more effective each practice can be, the more effective the whole system can be. So that is around making sure that we're all doing the right things, the most up-to-date and the most patient-centred ways of delivering care. We will know we have been successful when, and this is another important part of the Pou Ora model of care. We heard really clearly that practices wanted to know, what does this look like when we're doing it in a really amazing way? What are some of the data we could collect, or what are some things that we will notice to know that what we are doing is being successful in terms of the value for patients, the value for the practice, and the value for the systems. So I invite you now to go back to your feedback form. If you click onto the next page, section 2, that will be specifically around Te Pou Kaimahi, our workforce Pou. So again, I'll give you a couple of minutes just to read through those questions, read through the elements of this Pou in detail, and share your feedback with us. And I will have a breath. We haven't had any questions come through the chat, yet? Not yet?
We have a question from Carrie Ann. She's asked, how will this Pou improve workforce capability for meeting the needs of disabled people?
Oh, beautiful. I love that pātai. Kia ora. Is it Carrie Ann, did you say?
Yes.
Oh, kia ora. So what was really important to us in the development of all of these Pou, including the workforce Pou, is to remove as many barriers as we can to providing and receiving quality care. Can I just go back to the question, Ni? Is this around workforce, kaimahi, or patients who have
I would say it's the workforce capability. Will it meet the needs of disabled patients? Yeah.
Beautiful. In terms of...
So Jess has replied with a comment I've just seen here.
I can jump.
Jess,
jump in thing. So I think that, great question. Agree with Barnaby, a really good one, and one to kind of highlight. I've just put in the chat, my answer is kind of through the advanced workforce pathways. It will encourage practices to think about what next for kaimahi Paikaha. So if you are kaimahi working in a practice that has disability needs, what is the advanced workforce pathway for you within that space? So it is looking around each individual within their, I guess, role within the team, and then how do we help support them? And that doesn't necessarily have to always mean a career pathway, as in nurse to nurse prescriber to nurse practitioner. It could mean around serving your needs better in the practice as kaimahi. So hopefully that answers the question in Patai. But if Kerry Ann, you wanted to jump on and provide a little bit more whakaaro around what you'd like to see a little bit more explicit in this po, we'd be really open to receiving that feedback. Kia ora.
Ai, kia ora. That's beautiful. In terms of meeting the needs of our whānau whaikaha, how will a practice ensure that they are meeting the needs of people in their community that have disabilities? Further along in one of our po is population stratification. And this is a process that we really encourage, or that is actually fundamental to providing quality care, is to do population stratification for the community that you're serving. So a practice who uses the Pou Ora model as part of their population stratification will look at, okay, what are the types of disabilities that our whānau have in our community, and what can we do to ensure that we know what the needs are of that community. So that'll be things like patient surveys, connecting with lived experience, all of those beautiful things that practices can do at an individual level to ensure that they know their people that they are serving. So we will, that will sort of come up a little bit later, but hopefully that will give you some reassurance that there are processes in place for communities of care, or your primary care, to ensure that they're meeting the needs of your community. Kia ora. Okay, the second po we're going to talk through is Te Pou Ora, which is access to acute care. So acute care shouldn't feel chaotic. It should be smooth, same-day care that has really clear processes that the whānau you're caring for and your staff can just easily and smoothly go through those processes. So ensuring that you have features like digital bookings available through your app or digital front door, ensuring that there is a clinical triage process, and also providing tools that whānau can use to help at home. So as we develop this po, we are going to create resources and templates, for example, a chatbot template, triage scripts. So we do already have some on our website, but revamping those. So there are actual scripts that someone who's doing clinical triage can read to ensure that they're gaining the right information to make an informed judgment about how to resolve or find the pathway for the person who is seeking care. And also implementation guides, so how you can ensure that you have a smooth, same-day access to care process. So in this po, this approach enhances responsiveness, minimises treatment delays, and ensures patients receive appropriate care when they need it. So again, we're starting from the bottom up. What is the closest thing to home that we could do to support our whānau? So your website might then provide some self-help things. So here are some remedies if you've got a little bit of a sore throat. Here are some things you need to watch out for if it's looking a little bit better. Here is the sign that you might need to engage with a professional to seek extra support. Here is something, the symptoms you might see if it's straight to acute care, or here, these things are really, really serious, get to hospital. Of course, that's a very simplistic explanation, but hopefully you see what I mean. So self-help at home. Triage technology, so using different tools or resources, digital ways of triaging people to ensure that they get the care that they need at the right time. Digital booking systems, so we know still that some of the practices across Aotearoa don't have a way for whānau and patients to book online. It's still a ring up phone call situation. So what we know from our research and our mahi with practices is that digital booking systems have a huge impact on the day-to-day mahi of people giving care. Clinical triage assessment, so ensuring that there is a clean, smooth process to triage whānau, and that digital supports are used to not to make decisions, but to help with the journey. And then providing an acute care clinic. So knowing your whānau, knowing the patients that you support, going back through population stratification, going back to your times of highest need, thinking about what would be the very best time or way that we could actually have a clinic available for walk-ins for acute care. Now, for big or high ESU practices, this may seem quite achievable and quite easy. Kapai, like for 4 hours on a Monday morning, you'll just have an acute care clinic people can walk straight into. For smaller practices or smaller communities, that might mean collaborating with other practices within your PHO to then pool your resources and have a clinic at one of the practices, even if all of the patients going there aren't enrolled with that practice. So we are developing a variety of resources and tools and gaining examples from people across the motu who are working in collaboration with other practices to deliver acute care clinics. So we think that's a really exciting part of this model of care. So again, on the left-hand side, we have the really explicit value propositions for patients and whānau, for your practice. How is it going to make a difference to the day-to-day running of your practice? And how is this going to help us across Aotearoa at a system level? And then we have how we know we are successful, and some clean and clear ways that you can know if you're doing a really great job implementing these elements. So I invite you now to go back to your form and to the survey and complete or answer any of the questions there. Provide your feedback. What's missing? What feels great? What feels unachievable? What might you need to implement a really clear acute access process?
Just have a comment in the Q&A, Marama. So from Joy, we've got a comment here that says, interested in your comment on, she was talking to a patient who has no phone or address, no access to digital parts of acute care. And the other thing is that many patients assess themselves as needing appointments today. So would survey as disappointment if triage is not needed one. Not clear on that last bit, but I'm assuming it's about that patients tend to assess themselves anyway when they do ring up, they do need an appointment today. Just let me know, Joy, if that's not clear.
One of the things that I find really exciting, and Jess might want to add to this, is around changing the whakaaro of our communities, that the only person that can help you with your medical care needs is a doctor. And what we really want to do is have patients understand the range of people within each practice who can actually help them to come to a decision or a pathway for the care that they need. So often, yeah, we get this all the time. Every practice has it. Someone calls up, says, I need to see a doctor today. Some of the scripts or the sentences in our scripts will ask things like, tell me about what's going on for you so that I can put you forward to the person who can meet your needs. And so if it's, for example, an earache, that person might not actually need to see a doctor. The triage clinician will say, sounds like you might have an ear infection. We have a nurse available who can see you, and they will be able to, if it's a nurse practitioner or a nurse prescriber, they will actually be able to give you a script for antibiotics if that's what you need. So it's around being really clear on the people who are in our care teams to reduce the burden on just seeing doctors. Jess, would you like to add more to that?
Yeah, I think it's around and not or. So digital tools will support many of our patients to be able to access care in a way and in a methodology in which aligns with them and they like to. But it will not solve the problem for all. So what we have kind of leaned into a bit here is the whakaaro of, if you have a lot of your patients using a digital tool to be able to book same-day care, then you're freeing up capacity for your administrative staff on site to be able to manage and direct and navigate for those that need to call, need to hop in, walk in, whatever their kind of requirements might be, and they're not bogged down answering the phones of many of us who are capable of booking digitally online. So it is a bit of a journey, and I think many of you listening will go, oh yeah, but the digital booking systems at the moment aren't up to speed, or they're not working, they don't have all the capabilities. So we get that and we hear you. So we are working with our portal vendors, and we will be releasing a paper in a couple months' time that looks to advise vendors around what they need to include in their work plans and in their kind of digital tools to ensure that some of these problems are solved for, because currently the technology that we have in New Zealand is very average compared to what's happening kind of internationally, and we do want to bring our New Zealand kind of portal vendors up to the same level as some of our international counterparts, but also to ensure that they best meet the needs of our whānau, and also make it really easy for the practice to be able to turn on some of this functionality, because we do understand the complexity in there. Another question's just come through around digital and what about the people who don't have a phone? So I think I've just covered that will have that kind of capacity at the reception kind of administrative level to be able to support when the majority are being able to come through digital pathways, and also can't speak English. So there's some really awesome technology coming out that are going to be able to support us better than we've ever been able to be supported in general practice around language barriers. So if we think about some of the AI tools that are coming into practice, some of the different translation tools that are there. So when we talk about kind of digital enablers a little bit later in the innovation Pou and some of those AI enablers, things like that will really kind of transform how we deliver care for people that don't speak English as a first language, or would prefer to receive healthcare advice and support in a language that is more familiar to them. So although it's not perfect, I don't think any system will be perfect. It does provide us with some mechanisms and some little acts of change which will help kind of, I guess, shift the dial in that space.
Oh, kia ora. And I just want to, whakakapi that with the idea and exactly what you said, and is that we provide a smorgasbord of options that people in whānau can choose the best one that is most effective and efficient for them. So we're not saying this is the one way you can only access our clinic if you book digitally. It's saying this is this is available to you, and if it's quick and easy for you to do it that way, that's great. And if lots of people do that, then there is more capacity to provide alternative ways of connecting. So we're not saying don't do anything or only do this. We're saying let's add it to the ways that we engage with our whānau. So hopefully that answers that part, Tai. Beautiful. So this pou karo here is around proactive and preventative care. So you will recognise this from Healthcare Home. We had proactive and then preventative care separately, so we've pulled those together. So in this pou, this is where we are really advocating for a system where long-term health planning is the norm. So we focus on early intervention, population stratification, planned care clinics, and using really good quality Pou Ora plans that are co-developed with the whānau or the patient that you're supporting. So this pillar ensures that patients receive the right care by the right healthcare professional at the right time by the most appropriate mode for them, reducing unnecessary hospital admissions and ensuring continuity of care within general practice. So within this pou, as I mentioned just before, we'll start at the bottom. So Pou Ora plans is something that has been around for quite a while. What we want to do, and what the next phase of the development of Pou Ora is to share with you some really amazing examples of Pou Ora plans that are made with whānau, that are whānau led, that are patient owned, that has really clear pathways or tools and resources to support long-term and complex conditions. So we really would want to see that embedded using the population stratification method, that our people with the most complex health needs have really robust Pou Ora plans that are living documents that are added to by the patient and their whānau and the multidisciplinary team that they're working with. So it might not just be a doctor to patient. It would incorporate, those regular nurse visits, or those, if you have to have 3 monthly blood tests, all of those things will just keep adding to a Pou Ora plan to help navigate, the longevity of the journey. Planned care clinics. So we know, again, that lots of practices and community care providers have clinics. Diabetes clinic where people come together who have the experience of diabetes, and oftentimes are run by someone with lived experience of that. Not always, sometimes it's run by clinicians to give medical information. So really honing into that opportunity to build small communities through these clinics. Now, I do just want to make a quick plug here to the Health Navigator Trust. They have just developed a document called Pou Ora, it's Journey to Wellbeing, the document's called, and that has some really great hints and tips around how to create amazing clinics. And one of the things that they say in there is that peer-led or lived experience people running clinics gives you the most success. So that's just something I want, for you to maybe go and check out if you are looking at exploring planned care clinics. digital screening tools. Now, this is something that will be ever changing. There are lots and lots of examples now of really easy, simple digital tools that can be used to help with the recall process. So we know things like the self-swabbing now for HPV, although that's not a digital tool. We need to make sure that we're always at the very front end of new developments, so that our processes for recalls or for that preventative and proactive care services are always in line with the best technology. And I know Jess has been working with, gosh, I don't know the details, but around a digital way of taking a photo inside a bubba's ear to see whether they would need grommets or, can you explain that a little bit better than me, Jess?
So I think this post really looking at different ways in which we can screen our patients. So you probably have jumped to the innovation Pou a little bit in this space, which is around kind of AI clinical diagnostic support tools. But in this Pou, what we're really wanting to lean into is the digital screening tools. And that's things like our smartwatches these days can take so much information around what we're doing at home, our heart rate, our blood pressure. They are getting smarter and smarter and smarter. So how are we using some of those tools to be able to inform what's happening in the general practice and in the kind of planned and proactive care arena, especially for whānau that we are needing to closely monitor what's happening for them in that space. So digital screening is, I think, quite broad. We haven't kind of really nailed down what the things are that will fall into that, but most of it will align to how whānau can, I guess, look after themselves in their home and report back information to their medical centre in a technological savvy way that doesn't overburden the practice, doesn't bring in a whole lot of unnecessary data into the PMS, but does alert the clinician to when somebody is starting to require care, or maybe we can get ahead of an acute transaction by having a little bit more information about that patient or that person. And then gone are the days that we need to sit down. Hopefully, this is my vision, right, for 25 and beyond. Gone are the days of sitting down at the PMS doing recalls with a screening book and kind of ticking patients off as we go, or going through our thalamus dashboards and recalling every single person. Having some AI and some digital kind of recall processes in place to support this. It's not going to replace it. It's a kind of the and again. If we can push out some of that information and some of that recalling digitally using really smart tools, then it creates that capacity for the phone calls to whānau that do need a little bit more information or awhi. It does create that capacity for approaches for those that need it the most, which therefore kind of creates that real equitable model within the care. So those that are able to and can just receive a text reminder around needing to pop in and do their HPV screen, kei te pai, and those that need 3 or 4 phone calls and a bit of awhi from their practice nurse, that capacity is freed up through the kind of, I guess, trade-off by using these digital tools. So this is a really exciting Pou. I think it's one that a lot of nurses that do a lot of recalls will be wanting to see what toolkits we do push out from this Pou that will be able to support better flow of recalling and looking at proactive and preventative care. And I think it's also about how we get better at using the population stratification information that we've got. So most people in most practices now will be able to see all of their patients and who is coming in the most and who's not coming in at all and who's presenting with what conditions and which patients have more than 50 medications or 15 medications and who needs support in what elements. So how do we take that information to have a better proactive and preventative approach to the way in which we're delivering healthcare? And then I think the last thing just to touch on in this space, as I'm on like a little bit of a flow, is the clinics and the planned care. So as we've heard from this government, there's going to be more and more planned care opportunities pushed out into general practice. And I call them opportunities because for whānau, they are opportunities. If I can get my care delivered for me in my community, that is a massive opportunity for me. And so how do we as a general practice or as a community be able to provide a facility or provide a space for that planned care to happen? And those that were at our conference a couple of weeks ago in Wellington, we had a beautiful example of how gynae services are being delivered in the community through a planned care clinic that's in collaboration with a general practice Māori health provider, and also a good, strong relationship with the specialist care providers from the Health New Zealand local hospital. So bringing those together. So it's not saying that you've got to do it without resource or without specialty services. It's about creating that space and that model that will sit within the practice to deliver that care. Sorry, Marama, I just, injected my whakaaro.
Never be sorry. It's all so exciting. It's all so exciting. The last part of this Pou that we will just finish off, you just did mention population stratification, which again isn't new. This is part of the healthcare home model of care, as is extended hours. So we know that practices have to be open between specific hours, but also increasing access to those people who can't make it in those hours, having some times earlier or later on, a day a week or a couple of days, where you can change who is in your practice at what times to ensure that extended hours are available for the people in your community if they need it. So, ko tērā te Pou karo here. If you have feedback, please feel welcome to put it in the form. I am just going to go through the last two so that we do have even 5 minutes left for pārtai and questions at the end. Okay, so innovation and sustainability, te Pou Ora. This Pou is about being future focused. Embracing the change, the fast-paced change that's happening at the moment and making it work for you. So we're talking about AI and AI tools. We're talking about virtual care, business continuity, succession planning, ensure that we can sustain treating and supporting our patients even with changes of staff. Digital equity is really important to this, and ensuring that we have the and again, that we have lots of supports available that are digitally focused, but that we don't then take away those opportunities for access in that kanohi face-to-face ways. So in this Pou, there are 6 elements. And again, we'll quickly run through just from the bottom. So patient engagement, developing ways in which you are engaging with the population that you are serving. Improvement methodologies. So if you are familiar with healthcare home, lean methodologies, that continuous cycle of improvement. And there's lots of methodologies that are available to you to go through that continuous development. And through the development of this model, we will also then provide further tools and resources for you to use. Digital front door, so some of you might call this your portal, which is a way of your patients and whānau engaging with their medical information, so making sure that everything is open. We, correct me if I'm wrong, Jess, but I do personally advocate for open notes and really encourage practices to have open notes. Oh, yeah, good. And that these can be accessed through the digital front door or portal. You using AI enablers. So again, every day there are new developments and innovations that will support our system to be able to provide better care faster. So using digital enablers, and I referred before to a tool, an AI tool that's used for bubbers with their ears. So we will be seeing these coming at us every day, and so the role of Collaborative Aotearoa is to highlight to you some really successful tools that we think will help you in your practices. Succession planning. So I guess it's kind of like population stratification, but for your practice. So who is currently working there? What does the next 5 years look like? Are you having some of your care providers who will be retiring? Is there going to be, 5 or 6 within the next 2 years? And if so, what is the plan to ensure that your community still receives the care that they have come to expect in the care that's right for them? And then virtual interaction, so virtual patient coaching, navigation, and access to monitoring. So one of the things that Collaborative Aotearoa have been developing lately is an app called Collab Coach, and it's in the pilot stage. So this is an app that is used by navigators or coaches or HIPS health coaches. There's an array of whānau supports who can interact with patients on the daily. It collects stats. If someone has a smartwatch, then it gives notifications to the person who is supporting you through the process. So there are lots of really exciting virtual patient experiences that can really bring together the patient and the care provider in unseen before ways. So we're really excited to continue to develop the virtual opportunities that exist for us now. Not to replace kanohi ki te kanohi, but to add as another option, another choice for patients. Ka pai, I'm going to skip straight to collaboration. So this Pou, we actually started off by calling it strategic partnerships. Engari, what we know is that on the ground, in the practice, collaboration is going to could have a really powerful impact on the care that you deliver. So we're not talking about collaboration as a buzzword here. We're referring to it as a real engine of equity. So this is about building really meaningful partnerships with people in your community, other care providers, NGOs, hauora Māori providers, your rongoa providers, lived experience rōpū, really collaborating with the people around you so that we can together address the really big hard things like the social determinants of health. And the Collaborative Aotearoa have a variety of tools and resources already that you can use to explore how to collaborate with people and organisations within your community. So, for example, the Kia Kotahi partnership model is a really great resource to use if you're just starting to engage in the journey of collaboration. So when we talk about te pou hono, we're talking about collaboration. Now, this has actually been the hardest one for us to develop, and it's that real sorting of what is the role or the opportunities for collaboration for a primary care provider. What are the things that are at that level, but then what are the things at the meso level? So, for example, we talked about IMPBs and PHOs. So we have in here, I think we still have it in here, partnerships with IMPBs. Engari, we wonder whether that is a realistic collaboration to have at a practice level, or actually is this a PHO or meso level collaboration? So we would really love your input in here. So we've got wider determinants of health at the bottom there. So that could be engaging with your local oranga tamariki, WINS, all those MSD, my apologies, all of those in NGOs. Whānau engagement, so how are you collaborating with the whānau and the population you serve? Community and social service providers, and then other primary care networks. So that is your PHO. That is other practices that you could collaborate with to extend hours, at different practices, but for your same community. So if there was one part of the model that we really could do with some extra input with, is around what is realistic for practices in primary care providers in terms of collaboration, because we feel that we haven't quite got that right yet. So would love your feedback on this particular Pou. Although we only have 2 minutes left to go, what I would like to do is just invite any final questions or whakaaro or feedback while we're on this webinar. But then I do really encourage you to go back through this at your own pace and fill in the form, because if you don't think that all of these elements are going to make an impact on the care that you are delivering, then you're not going to use it, if that makes sense. So we really want this to be deeply effective, very simple, and very actionable. And then our job as the collab is to make sure that it's very well resourced, that you have easy to follow guides, implementation toolkits, and examples from the network, from our sector. So is there anyone that would like to shout out any questions or feedback at this time?
There's a comment from Rob. I just wanted to reassure, kia ora, marama, that was an amazing presentation. So his question was around just clarity over what this is and what we're implementing. I just wanted to say that we're incredibly proud of this journey, and it has brought us to this point, for more than a decade ago. Key partners of key PHO partners, when they first introduced the healthcare home model of care to the shores of Aotearoa, it's really evolved to this beautiful so that's the old booklet that Marama is holding up. So what we're presenting here is this beautiful evolution of the kawakawa bush that was presented in that booklet, to a modernised, fit for future, fit for purpose that's harnessing digital technology and supporting our workforce through the changes that they're going through at a system level and even at the front line down on the ground. So this isn't something that we're implementing at the moment. This is an evolution of our model of care that we're so proud of, and it's been around for over a decade now. So I just wanted to support and awhi that kōrero, and hopefully that answers your question, Rob.
What I might... Oh, sorry.
Yep. No, you go ahead.
I was going to say, the way that I thought about this as someone who hasn't got extensive experience in the health sector, I come from an education background, is, okay, if I got a job as a practice manager tomorrow, or I bought a practice and it was mine and it was my business, and I had a team, was employing a team, what would be the things that I would need to know and do to ensure that the practice that I was running would meet the needs of the community that I was serving? So it was really bringing it down to, okay, I wouldn't know at all what I was doing if I was running a practice. So what is a really clear, easy to follow way of knowing what I would need to do? So that's sort of personally where I came at it. Someone like Jess, who has been a practice manager, who has, a huge career within health, she will have come at it at a different, with a different whakaaro. But for me, it was, I would need something to go through. How do you run a practice? And I feel like from everything that we've learned and put in here from the people who are actually doing the mahi at the moment, this is something that would help me to run my practice. Ko Ka pai, any other questions in there, Ni, or shall we wrap up? People are starting to jump off now anyway, so. Anything last from you, Jess?
Kia ora. No, I think it's been a real wild journey getting to a point of review and reimagining the healthcare home model of care and thinking about where to now for modernised general practice in Aotearoa. And I think that when I think about this model of care, it is really thinking about how our practices can continue to serve the growing need that we have in our community. So things have changed quite drastically over the last 5, 10, 15, 20 years, and our models of care need to continue to evolve and keep up with the changes within our communities. We've got a very big ageing population in Aotearoa. We've got huge inequities in our communities. We need to think about delivering care in a different way to keep up with the demands that are being placed on our practices. So this is one way. There are going to be other models, and Collaborative Aotearoa will continue to look at all models of care. The Pou Ora, or the pillars of health, will come with substantial toolkits to be able to support implementation. And what we did learn through Healthcare Home is implementation isn't one and done. It is about thinking about your kaupapa within your practice and what is going to work. Do we do it bite-sized? Do we need to do a couple things at the same time? What is the appetite of your team? What is the change willingness and adoption of your team, and then working at a pace that enables the change to be sustainable. So it's not rip the band-aid off and put it back on Monday morning, because we know that that doesn't sustain change in the long term. So it is going to be about working with practices at an individual level, at a PHO level, to be able to really see how we can evolve the model of care in a sustainable and a really practical way that makes us enjoy the process, because we've got to live and breathe living and working in general practice and in primary care, and we want that to be something that we continue to love and enjoy. So your feedback will be taken on board. We will listen to all of your little things. There's been some really awesome comments in the chat today, or the Q&A, that's kind of just sparked and provoked a few things for me. Also listening to it today has also sparked a few things, so we really will take your feedback on board and make sure that that is reflected in the final version. So you're not looking at the final version yet, you're looking at the out to the health sector for consultation version. So kia ora. Thanks, Marama.
Kia ora, Jess. So this webinar has been recorded and you will be able to access it on our website, www.colab.org.nz, probably by Tuesday. Obviously, we've got a beautiful long weekend coming up, so if you just search for the webinar tab, then you can find it. But like Jess said, before I close with karakia, I just want to take this opportunity to thank you all for coming to this and learning about Collaborative Aotearoa's model of care, Pou Ora, the pillars of health. So thank you for coming, whether you are with us live right now, are watching the recording in the past, in the future. We really thank you for your interest in exploring this model with us. Ngā mihi aroha kia koutou mō te kaupapa o tēnei rā. Ko te karakia whakamutunga. Ko rangi nui e tū nei. Ko papa atu anaku tākoto nei. Kia tau te rangi Māori e, ki ringa i tō tātou mahi tahi. Haumi e, hui e, tai ki e. Ka kite koutou.